mode.
Hi there. I'm going to go ahead and turn on my webcam and also um, just make the screen a little bit bigger. Hi, everyone. If I could orient you over to the side, there's that control panel where you have the questions. I'm going to go ahead and ask if you can let me know if you can see my slides and if you can also see my webcam. So if you could, I'm going to go ahead and put this in presenter mode. Oh. All right, can you guys see me okay? Yes, okay, great. All right, so I'm gonna go ahead and get started then. The way that I'm gonna go ahead and do this webinar is I'm gonna go through my slides and I'm going to be explaining some things, and at the end of every section that I'm gonna cover, I'll go ahead and open it up to questions. So if you have any questions at that point, I'll answer it, and you can just type them up in that section on the control panel. All right, so anyway, welcome to the webinar, and I'm going to be covering advice for the medical school application process. I'm going to be covering that whole period of submitting your primary application up through interviews and even beyond that. My name is Mitty, and I work as an advocate with Pre-Health Dreamers, and I'm also starting medical school at UCLA, so it's an exciting time for me right now. I'm in the middle of orientation week. All right, and so here are the topics that I'm going to be covering today. I'll be starting with the AMCAST application, or your primary application. I'll give a little bit of information about secondary applications. I'll cover interviews, and again, I'll cover a couple other topics beyond interviews, such as update letters and letters of intent. And again, I'm going to open it up to questions after every topic that I cover. So this is your medical school application timeline. I'm going to orient you to the bottom of the slide where I have the reference. For a lot of the resources that I'm including here, I list the reference, like the website itself, and I uploaded the handout. So on the control panel, you'll actually see that the handouts are listed there, or this handout is listed there, and you can download it for yourself, and you can access these resources yourself. So this is a timeline, and a lot of people aren't very familiar with what the process looks like, but it actually takes a full year for you to submit your application for medical school. The application opens up in May, but you can't actually submit your application, your primary application, until June 1st. And so for that reason, you can start actually inputting things into your application in May. You can't submit until June. It's still recommended to submit as early as you can. And again, one of the things that you need to know, if you don't already, is that the application cycle for medical school is on a rolling admissions basis. And what that means is that as the application cycle opens, even though you still have time to submit all the way up through December for your primary application, even though it's possible to submit during that time, they're already going through and inviting people for interviews. They're already possibly accepting people and filling up slots. So as you apply later on in the cycle, there are fewer spots for you to compete for and to possibly get accepted for. So again, what that means is, ideally, in an ideal world, you would take your MCAT, you would prepare for it and take it before May. It takes a month for you to get your MCAT scores. And so if you take it, by April, by May, you should be able to get your MCAT scores fairly early. So at the top of that chart, you can see that it's recommended for you to take your MCAT between January and May, so that hopefully you get your scores before you submit your application, and it's very early in the game. Now, your primary application, which is the next thing that I'm going to cover, that's the first application that you're sending out to medical schools. And this is standardized information that every medical school is going to see. And while the application, again, you can start filling it out in May, it doesn't officially open until June, and you are recommended to submit it between June and July. It's possible for you to submit between August and December, but again, like the later that you wait, the fewer spots there are going to be for you to compete for. After you submit your primary application, the next step is a secondary application. So for secondary applications, again, all the schools that you designate that you want to apply to are going to see your primary application, but your secondary applications are unique to each school. So each school will send you another application, more paperwork for you to fill out. And what they're asking for is really dependent on what the school's mission is, what their focus is, and what they're looking for in their candidates. So some of these secondary applications might just be 1 or 2 additional essay questions, whereas some of the secondaries that I received had up to 12 questions that I needed to complete, maybe more. So just know in advance that these secondary applications do take a lot of time. And again, because it's still rolling admissions, your application is not technically complete until after you've completed your secondary application and submitted it to the school. So yeah, and the next step is interviews. Interviews can happen anywhere between July, January. Some of them can even go as late as February of the next year. And you should be getting acceptances between November and March. And I put this on the side of the slide as well. You should note that you can move off of wait lists at any point until school starts. So usually, schools are going to let everyone know who they have accepted by the end of March. By April 1st is usually the date that everybody knows where they've been accepted. But in the meantime, people are getting accepted to multiple schools. They may actually be holding on to spots in multiple schools. So another thing to note is that by April 30th, that's the date when people are supposed to let go of their acceptances at multiple schools and only keep their acceptance at one spot. What that means is that if you're waitlisted at a school, then they may actually move you off of the wait list after April 30th, because again, at that time point, everybody is letting go of a lot of different schools that have accepted them. And, I've heard of people getting accepted into programs as late as, a week before school actually starts. So while usually you're hearing most of your primary acceptances between November and March, you may get additional acceptances later as you move off of the wait lists, particularly after April 30th, when people are supposed to let go of all of their spots except for one. All right, so that was a lot for that slide. Let's go to the next slide. Another thing that I want to cover is the fee assistance program. If you qualify for the fee assistance program based on your income and your parents' income, you can take advantage of a number of different benefits. One of them is that you have a reduced fee for the MCAT, so it goes down from $305 to $115. They give you a lot of the preparation materials that the AMC has for the MCAT for free, and you're able to make use of these resources for 2 years. The other thing is that you do get complimentary access to the medical school admissions requirements, or the MSAR. The MSAR is this fantastic resource. You log onto it and it gives you detailed information about every school that you might be interested in. All of the medical schools list, their average GPAs, their average MCATs, their mission statements, the total number of people who may be applying as in-state versus out-of-state. You get a good sense of what the school is like. So that's actually where I would start to go for, just research on what types of schools you might be interested in applying to. The other thing that the fee assistance program gives you is AMCAST benefits. So essentially, you're going to be applying to, a number of programs. I hear mixed opinions on the total number of schools that you should be applying to. Some people apply to 30 schools, some people apply to 10. For me, I actually went for 20 schools. I applied to 20 schools for medical school. And if you qualify for fee assistance, the AMCAST fees for your application submission are waived for 15 schools. So your first 15 schools are free. And if you want to apply to more than 15 schools, you do need to pay for those additional ones, but at least you're getting a substantial discount. So again, if you're interested in learning more about the fee assistance program, definitely log on to the AAMC website and check if you qualify. All right, I'm going to go ahead and start with the AMCAST application. Actually, first, can I just double check? Does anybody have any questions about what I just covered? Okay, all right, I'm going to go ahead and move on then. All right, so we'll go ahead and go into the AMCAST Primary. And I'm essentially going to be walking you through the entire primary application. I pulled a lot of screenshots from basically AMCAST themselves. And this is actually what it looks like when you first open up and log in. So, look up AMCAST AAMC and create your login. And you can see at the top here, these are all of the different sections of the application. You have identifying information, the schools attended, all of this biographic information, as well as your activities, your letters of rec, your personal statement, your standardized tests. It's all up here. So this is what you're going to be seeing when you log in. And this first section right here is the identifying information section, or your demographics. So this is what it's going to look like when you click on it. You'll have, it's very straightforward. This particular section is really straightforward. They'll be asking you for your name, your preferred name, alternate names, your birth and your sex. The second section, or the schools attended, you'll have to list your high school information, and also all of the colleges that you may have attended. So say that you went to community college while you were in high school, you'll want to include that. If you went to multiple community colleges, you'll need to include all of those different schools as well. And you're also going to need to, right here under transcripts, you'll actually need to send your transcripts for all of these different schools. When you click on this tab, I can't show it to you right now since this is just a slide with a picture, but if you click on transcripts, it'll actually give you more information about how to properly request official transcripts and get them sent over to AMCAST. And then the other information you need to include is, have you ever had any kind of institutional actions against you while you were in college? All of this information will be asked of you. Okay, so then section 3 is again, it's more just biographic information. This is where you can talk about your citizenship, your legal residence, how you self-identify, languages you speak, information about your parents and your siblings, whether or not you have any kind of misdemeanor convictions. And then I also want to point out right here, there's an essay in the biographic information section called Your Disadvantaged Status. So I'm going to highlight this right here on the next slide. So the disadvantaged status is, it's a space for you to give a little bit more information about yourself to the admissions committee. And in particular, if you feel that you have been disadvantaged in any kind of way, it could be social. I actually included here, again, I included a website that you can check out, and also their description of what these different disadvantages could look like. So it can be social, being treated differently due to your ethnicity, language, or your religion. It could be economic. For example, you could have grown up in a low-income household. It could be an educational disadvantage, such as having a learning disability, attending low-performing public schools. It could be your immigration status. I was undocumented for a long period of time, so that was something that I discussed in my disadvantaged status. And this is again, it's a great opportunity for them to get to know a little bit more about you, and it also gives them context to understand, where you're coming from, if there might have been issues in, your academic performance or your test performance. This is another place for them to take that into consideration. And the way that you set it up is you're basically giving them a timeline of any of these different disadvantages that you may have experienced over the course of your life. So I usually start, I would start when I'm young, coming here, as an immigrant when, I was 5 years old. Our family faced, hardships in finding work and being able to support ourselves. And then I talk about how, my immigration status, Like for me personally, it was difficult to be undocumented, to face, barriers to education access. So those are the kinds of things that I discuss. And again, you're going through a timeline. You're giving them from the time that you were young up until the present. And, you're basically just stating facts. You don't need to talk about how emotional it was, how difficult it was. This is a place for you to just say things like, you were low income or first generation college student, all of that information. And then, you can end it on a high note and say how you may have grown from these different disadvantages that you may have faced. So again, this is an important section, and I do highlight it because it gives them a lot more context about who you are if you feel like you self-identify as disadvantaged. For the next slide. So section 4 is where you're going to be inputting all of your coursework. And if you can actually see here, I took a screenshot from the website itself, so you can see they're going to ask you for the academic term, your year in school, which is based on the total number of units that you may have taken. They do ask for you to include any kind of AP courses that you've taken. So you're going all the way back to high school AP courses in any community colleges you might have attended in high school. And then from there on, you're going to chronologically input all of the courses you've taken in college. And this right here is data entry. You will need a copy of your transcripts. Of course, for yourself, you don't need to get official transcripts. You can pull your unofficial transcripts from, your school's website, but you need to have all of that information accessible because inputting all of your courses one by one, it does take a lot of time. It took me a couple of hours of data entry to put everything in. So just note, this is one of those pieces in your application. All right, and then another thing that is important to note, they are calculating your GPA based on which courses you've taken that are BPCM, or biology, chemistry, physics, and mathematics. And they're calculating that separate from your total GPA and separate from like all other coursework or AO coursework. So this is actually pulled right here directly from the AAMC list of course classifications. And I'll go back to the slide again. You'll see under course classification, you'll need to put if it's chemistry, if it's biology, if it's physics, math, or if it's something else, if it's an other. And this can be a little bit tricky. Some people think that certain courses should count for BPCM when they may not. So for example, if you take an engineering course, if it's computer science engineering, that's not going to count as mathematics. The only thing that counts as mathematics is applied mathematics, biostatistics, mathematics, and statistics, okay? Calculus, all of these types of courses will count for math. But if you're taking computer science, that doesn't necessarily qualify, even though it may be very work intensive and you might think of it as a science course. Another thing is sometimes the course title doesn't really fit with what the course is. For example, I took an advanced statistics course, but the title was psychology. It was like Psychology 141. So even though it was listed as Psychology 141, the course content was statistics, and I could list that as a math class. So what I did was I actually printed out all of my transcripts, and before I inputted them, I actually just checked off which courses were biology, chemistry, physics, and math. That way it would be easier for me to put in the data entry without having to go back and forth with this guide of like what exactly each course counts for. Okay, so section 5, this is actually your 15 activities, if you've heard of that. This is where you're going to cover all of the different activities that you've had, like how have you used your time. And these can be academic, these can be extracurricular activities, it can be hobbies. This is really just for them to get a sense of what have you been doing with your time over these years, like how busy was your schedule, and to learn more about who you are and what's motivated you. So a lot of things can be included in here. Here are some of the types of experiences they're going to be looking for. Your research experiences are going to be listed here. If you have any conference papers or publications, you'll list it here. If you have clinical experience, for example, participating in clinical care extenders, shadowing, COPE Health Scholars is now clinical care extenders. All of these different volunteer opportunities that are clinical are going to go here. Community service that you might have done, so any of the student groups that you're working with, you know, when you're tutoring for free, like all of these different community service activities are listed here. You can also list all of your awards, scholarships, and grants, jobs that you may have held, positions you may have held, and again, any kind of hobbies or artistic endeavors that take a lot of time. So one thing about this is that I hear people say, you know, that you don't have to use up all 15 of your activities, but I actually recommend it because I think of it as, you know, each of these activities that you list is an opportunity for them to get to know a little bit more about you. So if you have 15 activities that you can include, I would include them all because, again, it just gives them, it gives you more space to write about yourself and to give them more information about who you are for them to make their decision. And this is the information that they're requesting in your work and activities section. You have the experience type, the experience name, a contact name and title, contact email, the organization name, dates, the total number of hours that you have been involved in this. So maybe you were doing it from January 2016 to present, and you've done 1,000 hours, you know, doing COPE Health Scholars or whatever activity it was. I actually make sure to keep track of all of the activities that I've done, or I made sure to keep track of them over the course of my pre-med career so that it would be easier for me to reference that when completing these applications. All right, so let's see. I'm gonna go ahead and, can you guys still see this okay? Please comment if you can still see it okay. Yes, excellent, thank you. Okay, I'll continue. So for all of this information, again, it's really good for you to be keeping track of all of the hours that you're doing for all of these activities, and make sure that you stay in touch with your contacts. I actually had some activities that I was involved in a really long time ago, and I no longer have the contact name for people who were there. The advice that I got for those situations was to, you know, list a person who knew that I was involved in those activities and who could vouch for that. So I listed a colleague who went to college with me for some of those activities. There was one activity where, you know, there's new leadership, and since I had lost touch with former leadership, I actually, you know, connected with the current leaders and just asked them, you know, do you have records of my participation? And when they said yes, I asked if they would be willing to vouch for me and for me to list them on this section. So that's actually a little bit of advice. You can do that. Okay, then I didn't explain this, but there's this section on the application called Most Meaningful. You actually can designate 3 of your activities as being the most meaningful activities that you've done. And for those activities, you have a little bit more space to talk about why those activities were meaningful for you. So here under experience description, you'll have 700 characters to talk about what the activity was. And you're really just describing the activity, what did you do? And that 700 characters takes up like a really small paragraph. It's very, very short. But for those 3 things that were the most meaningful to you, you actually can talk a little bit longer. So you get your 700 characters to describe the experience, and then you get, you know, another 1325 characters to talk about why this experience was most meaningful to you. A piece of advice that I was given was that it's really great to have letters of rec from people who are character witnesses to your top 3 most meaningful. So for example, I was involved in a research lab for 5 years, and I learned a lot from that research lab. I learned a lot from my mentor there. And for that reason, I made sure to ask my mentor from that research lab to make sure to ask him for a letter of recommendation. And it's good because it shows another perspective from somebody who's witnessed you in this whatever activity it was that you were really passionate about. Okay, so a little bit of advice. So section 6 of your application for medical school is where you're going to upload your letters of rec. Generally, what I noticed is that medical schools allow you to submit multiple letters of recommendation, and different schools have different requirements for which types of letters you should be sending. I would recommend having at least 2 letters of recommendation from people who were your professors in difficult science courses. These letters are important because a lot of schools require at least 2 science professors. And again, it's because they want to see that you can perform in medicine. So make sure that you get to know your professors. One of the things that I would recommend doing is actually creating a packet before approaching your professor. You've taken class, you might have been sitting in the front, you did really well, you got an A, you went to office hours. He kind of knows you, she kind of knows who you are, but maybe doesn't know you that well. You want a strong letter of recommendation, so you want them to get to know you a little bit better. And one thing you can do is ask your potential letter writer for a one-on-one meeting. You can email them and say, thank you, I really enjoyed learning from you this semester or last semester, and I'm in the process right now of applying to medical school. I would like to see, if you would be willing to write me a strong letter of recommendation. And then you can create a packet, email it to them that includes your personal statement, a copy of your resume or your CV. If you want, you can include your 15 activities for medical school, which you've just prepared for your application, and any kind of additional information that would help your letter writer. And this just gives them more information, so it's easier for them to write a letter for you, rather than just saying like, oh, this person got an A in my class and was really active in class discussions. You want them to get to know you better. So say that they say, yes, I am very happy to write you a strong letter of recommendation and I can meet with you in person. During that one-on-one meeting, you'll have that packet with you. This is what I did. I had my personal statement, I had my CV, I gave it to my professor, and then, I dressed up. I dressed business casual during this meeting, and then talked to my professor saying, this is who I am, this is what I want to pursue, and these are the kinds of things I'd like for you to highlight in my letter of rec. And again, like that's going to help you in setting you apart from other people applying, and letters of rec can make a big difference. So just make sure that you're getting to know, or letting your professors get to know you a little bit better. For most of the schools that I apply to, I think on average they would allow you to upload up to 6 letters of recommendation. And I had 6 letters. So I had 2 science professors, and then I had my research mentors, and then I had people who, basically directed me during, were my supervisors during some of the community service activities that I got involved in. And again, I made sure that 3 of my letters of rec were from people who could vouch for my 3 most meaningful activities in my application. I've actually covered a lot of information, and I just want to ask real quick, does anybody have any questions for what I've talked about thus far? I'm happy to answer questions right now about what I've just covered. I know it's a lot. Okay, so I see a couple of questions. Yes, this is this is actually being recorded right now. So just so you know, we will be uploading this to YouTube, and we're actually going to email it to everybody as well. Okay, other questions? For AP classes, can we put the info from our college transcript or from AP transcripts? You know what? I'm not sure I remember. I don't think that I pulled my AP courses from my college transcript. I think I just listed what I remembered. Yeah, I'm not quite sure if the information you need is from the college transcript or from your high school. Okay, next question. For the work activity section, do you only mention activities during your undergrad, or can you mention high school activities? I would only mention undergraduate activities with the exception of things that you've done that have gone on to undergrad. Like say that you started volunteering for Kaiser in high school and then you continued volunteering with Kaiser all the way up through your junior year of college, or let's say that you've been playing violin since you were young and then you've continued, you're still doing that. I would list it only if there's continuity with your undergraduate. Otherwise, I would not mention anything else. Okay. For the grades, how do they verify them? Okay, so that's a great question. And if you remember one of my slides, I actually said that you're going to need to send your official transcripts to AMCAST. So what will happen is you're uploading all of your grades, like you're inputting all of your grades yourself, so that they don't have to do that work, because they're calculating your BPCM GPA, your AO GPA, and then also your total GPA, and they need that information. But what happens is another person is going to sit down and compare your official transcripts with what you've inputted. And they're going to fix any kind of discrepancies. So maybe you thought that a class was a math class, but to them, they don't actually think of it as a math class, so they might change that. So they're verifying your grades with your official transcripts. And this is actually important to remember. The reason, I'm going to talk about this some more, but when you submit your primary application for medical school, even if you've submitted it, it's not going to all of the schools until it's been verified. So verified means that somebody has gone through and again looked at your transcript and looked at what you've inputted and made sure that they are consistent with each other and your GPA is accurately calculated. So it takes a whole month for your application to get verified. So if you submit June 1st, nobody's going to see your application until July, like early July. If you submit July, that means no one's going to see your application until August, et cetera, et cetera. If you submit, so that's why, again, it's really important for you to submit early because the verification process takes a really long time. Okay. Any other questions? Are you going to need high school transcripts? So no, you don't need high school transcripts, but again, if you've forgotten, which AP classes you've taken, I think it's important for you to figure that out. I don't know where you can request it outside of your high school or your college transcripts. I think you might need to connect with the testing board that runs AP tests. I'm not quite sure. Okay, another question here. I am in community college and I did very well in general chemistry. I will be transferring to a university next year. How early is too early to ask for a letter of rec? Will medical schools accept them if the letters are 2 to 3 years old? You know what I would do in this case, so if, let's say that you've already established really great relationships with your chemistry professors, you can ask them already and say, I'm not applying for another 2 to 3 years. It's going to take a little bit of time, but I am interested in going into medical school. Would you be open to writing me a strong letter of recommendation? And if they say yes, you can say, great. Well, what would be easier for you? I know you know me you know me really well right now. Would you be open to drafting something now, or can I contact you again and count on you for a letter in 2 to 3 years? And you know what? People are going to have different responses. I think what you want to do, regardless, is maintain your relationships with those people. Give them updates, let them know where you're at. People love to hear, where you're at. Where did you transfer to? What are you working on? So keep in touch with them. Continue to maintain that relationship, and maybe they've drafted something that they can build on, And if not, when it's 2 to 3 years from now, they'll still remember you because you've been, keeping them posted, and you can talk to them then about your personal statement, your CV, your resume, and then, they have a lot more time to talk about, or they've had a lot more time to get to know you and have more things that they can talk about. Okay, a couple more questions, and then I'm going to move on. How do you recommend approaching professors about letters of rec if it's been a couple of years since you took the course? Same thing. Even if it's been a couple of years, email them and tell them, I really appreciated, your course, and hopefully you did well, and that's why you're asking for a letter of recommendation. So you can say, I did well in your class. I am now applying for medical school. Can I meet with you one-on-one and talk to you a little bit more about who I am? Again, include your personal statement. See what they say. I mean, it doesn't hurt to try. Some of them will definitely remember you and be like, yes, oh my gosh, I would love to do that for you. Other people may not feel comfortable, so give them the space to say no. Give them that space and say, if you don't feel comfortable, I completely understand. I know it's been a couple of years since you've seen me. Okay? All right. All right, and then the last question, and then I'm going to move on, is when do we start receiving the secondary applications? I'm actually going to go into that in more detail. And it depends. Sometimes secondary applications are automatic and they'll just send it to you. And others take a little bit of time after you've submitted your primary application and it's been verified. I'll go into that in more detail. Okay, so I'm going to move on. All right. I also wanted to share this. So this is still with regard to letters of evaluation. One of the tools that I used and that I liked is called interfolio.com. You log in, I think you pay something like $13 to have access for the year. And the great thing is that you can use this to send it to your letter writers, like you can request letters of recommendation. Your letter writers will upload it, and then you have control of all of your letters. You can't see what they write, but you can see that they've uploaded your letter into this platform. And from this platform, again, I had 6 letter writers for my application. My 6 letter writers uploaded it into Interfolio, and then I could, send all of my letters to AMCAST. And Interfolio takes care of, putting your AMCAST ID on all of the letters of rec that are submitted for you. So I liked it. I know that there are other programs that are available out there. I'm just recommending Interfolio because I've used it and I know that it worked really well for me. But you can also, I think, just have letter writers submit directly to MCAT. But again, I used Interfolio, so I'm not quite sure how that process works. I just know that this made my life really, really easy. And the other thing too is for those of you who are getting letters of recommendation early, you can have them, you basically have those letters forever. Like it's in there, or for as long as you're keeping your Interfolio account. So I have these letters of rec still, and if I'm applying to scholarships, I can just submit the same letters to scholarships, to scholarship applications. Okay, so for section 7 in your application for medical school, this is where you're going to designate which medical schools you're interested in. Again, I highly recommend, doing your research first. Go into the MSAR, the medical school admissions requirements, again, MSAR, and look up all of the different programs that you might be interested in and really make your decision based on how well you're going to fit with the school. Schools, there's lots of incredible applicants for medical school. People have, strong applications, great GPAs, great MCAT scores, all of these different things. And so medical schools have a lot of choices, and what they're looking for really above that, GPA, MCAT, extracurriculars, they're looking for someone who's a good fit for their program. So say that, you're really interested in research, academic medicine is like what you're passionate about. You're going to want to look for schools that have that same passion, right? Like if a school is really into research and academic medicine and is going to give you the training that you need, that would be a great school for you to apply to. Now say that a school is very research oriented and you've never had any kind of research experience and you're not interested in it at all. It may be a waste of money to apply to that school if you're not a good fit for the program, if that program's not going to give you what you're looking for. And again, your chances of getting in are lower if you're not going to be a good fit for that school. So look up the mission statements of each school, look up the programs that they have offered for you, and think about how each of these schools that you're applying to are really a good fit for you and for your professional goals. That's one of the biggest things that I recommend. You're paying per medical school. Again, unless you qualify for fee assistance, this is a very expensive process. Fee assistance will waive your first 15 applications, but otherwise you're paying for each school individually. I think it's about $40 per school, and it's $100 for the first. I think it's around $100 for the first school that you're applying to. Now, one thing to note with the AMCAST Primary application, you can designate additional medical schools after you've submitted your primary application. Most of the stuff in your primary application you cannot edit. Like, you submit it, it's gone, it's out of your hands. You cannot edit your personal statement, it's just gone. But one of the things you can edit is deciding that you want to add additional schools to your list. Like, I decided after a month of submitting my application, I thought, I want to add 5 additional schools. So I added 5 additional schools, and that was not an issue. You just click on there and you pay a little bit more. Okay? All right. So Section 8, I'm going to dive into personal statements right now. So Section 8 is your personal statement, and your focus in your personal statement is why medicine? You're really trying to answer that question. This is not an opportunity for you to write about all of your accomplishments. It's not your life story. It's much, much more concise. It's about why medicine. So people make these mistakes where they'll start listing all of the different things that they've done. Again, you already have the 15 activities section for you to list all of the different things you've done. So you don't put that in your personal statement. If you're going to talk about one of those activities, you're going to talk about it in the context of answering this question, why medicine? Okay. The other thing, again, it's not your life story. You don't have to talk about absolutely everything about yourself. You're really honing in on why medicine, what has motivated you to pursue medicine, what exposure have you had to medicine? Have you had any clinical exposure? You do want to demonstrate that you've had that exposure already. And then lastly, what qualities do you have that will make you an excellent physician? And really important thing is to show, don't tell. People like to say this a lot. It's really important for you to tell a narrative. Think about, for example, if you're describing an experience, pull your reader into this story. What did the experience look like? What did it smell like, taste like, sound, feel like, right? Like, think about it in like a sensory way. What did the experience mean to you? So reflect on that. This is a reflection piece. And how did this experience motivate you to pursue medicine? And again, how have you demonstrated in there, like, show them what skills you have that would make you a really great physician. So a little bit more personal statement advice. Make sure that you write and rewrite. You're going to edit this quite a bit. I made the mistake of giving my personal statement to too many people to read it. You don't want to give it to too many people, but if you're going to focus in on a few people, I would ask from someone who knows you really well. You want someone who knows you really well to give you feedback about whether or not you're conveying your story. Like, does it come off genuine? Is it you? Like, somebody who knows you really well can give you that input. Ask for feedback from somebody who's experienced with this process. Not everybody who knows you well is pre-med or is a pre-health advisor or a medical student. You want to talk to people who are familiar with this process. So medical students, pre-health advisors, physicians, somebody who understands what they're looking for would be really great for you to get feedback from. And then the third person I would recommend is someone who has excellent grammar. So if you have an English teacher that you've worked with, if your school has a writing center, if there's someone who's really good at grammar and can correct all of your grammar for you, just make sure that you get somebody else who's good at that to take a look at your statement. Okay. So this is a sample excerpt. So I actually listed again the website up here where I pulled it from. I'm not wanting to plagiarize anything, so please look up all of the resources that I'm including in this handout for you. So here, I'm just going to read it for a little bit. My home has been a place of healing for many broken hearts, both literally and figuratively. My youngest sister had 2 open heart operations before the age of 2. I was 3 years old, and I tried to be the best big sister in the world. I thought that if I loved her enough, her heart would heal itself. Eager to gain hands-on experience after high school, I volunteered at Strong Memorial Hospital conducting a clinical study of patient referral patterns and shadowing a pediatric cardiologist. I watched a child's fearful face turn to an expression of amazement as he listened to the sound of his own heart. The little boy was so fascinated that he hardly noticed as Dr. Harris completed the checkup, expertly assessing reflexes, color, peripheral pulses, and responsiveness in the moments before the novelty of the sound wore off. Stethoscope in hand, I searched gingerly for the sound of the boy's leaking valve, but was not in time. The smile faded and I lost my chance. I felt an immediate sense of awe at Dr. Harris's swiftness, skill, and compassion toward the fearful little boy. So you can see that this person is telling a story. She didn't have to say that she didn't have to tell you, like, I've had clinical exposure to, a pediatric cardiologist. She's showing you what that experience was like in her interaction with this little boy. She's also given you her motivation for medicine. It began when she was young, when her sister had heart problems. So you get a sense of who this person is. And again, I just thought that it was a nice little excerpt to show you the kind of writing that you want to have in your personal statement. These people are reading a lot. Like, some people have 100 personal statements, 400 personal statements that they need to read through. So your goal is to make it a really interesting story so that they're pulled in and they want to get to know you better. One other piece of advice I would give for writing your personal statement is for having people read your personal statement, ask the people who are reading your statement to draw a line whenever they're bored. My colleague Rosa actually gave me that advice, and I thought it was invaluable. So have people read it, and if they ever get bored by what you're writing, have them draw a line. You want to make sure that your reader is engaged in your personal statement from the start to the finish. Okay? All right, that was a lot again, so I'm gonna take a pause right there and just ask you if you have any additional questions about personal statements or the information I've covered so far. So I got a question which is on like previous information. So the question is, if everything is centralized, for your primary application to medical school, it is centralized. So your AMCAST application that you submit is going to be seen by all of the medical schools that you're seeing or that you're submitting to. The only thing that isn't centralized is when the schools send you secondary applications. Those secondary applications, again, are unique to each school, and it's not a central application. It's going to be an application per school, and I'll go into that into more detail. Okay, another person asked, how many schools do you suggest applying to? It depends. It really depends. I think it depends on what you feel comfortable with. It depends on how much money you have to spend on this, because it was really expensive. I didn't qualify for fee assistance, and since I didn't qualify for it, I paid for everything out of pocket. with all of the application fees for the primary application, the secondary application, and my travel expenses and my suit, I spent about $6,000 to $7,000 on everything. And again, I applied to 20 schools. So I spent about $6,000 to $7,000 on 20 schools. So if you don't qualify for fee assistance, this is a very expensive process. If you feel really confident, like you have a strong GPA, a strong MCAT, lots of clinical exposure, you've been able to build a really strong application for yourself, you may feel comfortable applying to fewer schools. I applied to 20. I know some people who applied to 10 or 15 schools because they felt really confident. I know other people who didn't feel as confident and applied to 30, 40, 50 schools. But again, it's up to you because you know that you're making a really big investment in paying for all of these different programs. I think average people apply to is about 20 to 30. Okay? The next question I got, how long is the personal statement? It's about 5,300 characters, so think about it as like a page and a half, single-spaced. And again, it seems like very little space, but you're really focusing in on, your response to the question, why medicine? So don't give them everything, don't give them don't be repetitive. Like if you've already included something in your 15 activities, you don't need to talk about it again, unless you're talking about it in the context of why medicine. So yeah, 5,300 characters. So this next question, my GPA is not competitive. Should I talk about this in my statement or just focus on the points mentioned? I think, they're going to see your GPA. If you're going to talk about your GPA in your personal statement, you want to give context for why you may have struggled, and you want to talk about how you may have improved. So for myself, it just took me some time for me to learn how to study, and on top of that, because of other factors, I was kind of forced to take a lot more classes in the beginning, and that negatively impacted my GPA. So you can give your grades a little bit of context, but I wouldn't focus on it so much because it's already visible in other parts of your application. So don't just say like I got bad grades and then that's it. Talk about what circumstances might have been the reason for your grades. Maybe you were not academically ready yet from based on the high school that you attended. Maybe you were working full time. Maybe you couldn't afford to pay for school at the time. Like there's a lot of different reasons that might give more context to why your GPA might have suffered. So I would talk about that, and then I would go on a high note and talk about how you might have improved since then. What kinds of situations might have improved it? Like say, for example, someone I knew had to work full time while she was an undergrad. And so for that reason, obviously it's really hard to get good grades while you're working full time. But then she went on to say she did a post-bac where without having to work full time, she was able to excel. So again, if you're going to talk about it, just make sure that you're giving context to why your grades might have suffered, and then also talk about how you've improved since then. And then otherwise, move on. Any other questions? Okay. All right, so I'm going to move on. There's a lot of information to cover. So section 9 of your primary application is your MCAT, right? Like all of your MCAT scores are going to be shown here. This is the information that they include, not only your scores, but also your percentile ranks. And with the new MCAT, your percentile ranks are going to be really critical. Yeah, the other thing is your MCAT, again, just a reminder, it takes a full month for your MCAT scores to be released. So if you want to submit your application on the earliest date, June 1st, you do need to take your MCAT by April so that your scores are released and accessible by May. And then, you can submit your application in June. You'll get verified by July 1st. and then your application, your primary application gets sent out to all of the different schools that you're interested in, and then hopefully you start hearing back about secondaries. Okay, so again, this is great. This is the same thing that I just said. It takes 4 to 6 weeks to be verified. Until then, schools do not see your application. So make sure that you're sending all of your transcripts in time. All of your official transcripts need to be sent to AMCAST. Absolutely have to get that in so that your application is going to be processed in a timely manner, and your schools will be able to see it rather early. The other thing is, after submitting, you can only make changes to, again, designate additional schools, 1, and 2, to add or remove letters of recommendation, okay? So that's really important. Just know that those are the only changes you can make to your application, and that's it, okay? The other thing, while I'm very much emphasizing that you should submit as early as you can, it doesn't mean that you're not going to be able to get accepted if you apply later. I felt pretty strong. Like, I felt like my application was really solid. So I submitted my application in like the end of July, early August. I submitted all of my secondary applications around September, October, and I still had several interviews and acceptances. So just know you don't need to submit June 1st. It is just recommended to submit as early as you can to ensure you have as much opportunity as possible to get accepted. Okay. All right, same thing, submit early. Okay. So secondary applications. Again, every school is going to be unique in how they handle their secondary applications. There's what are called automatic applications versus screened applications. So automatics, it means that absolutely everyone gets a copy or gets the secondary application. A lot of private schools do automatics. So if you submit a primary application and then you get verified, as soon as you get verified, that's when it's released to all of those schools, and all of a sudden you're going to get all of these secondary applications in your inbox. Okay. For screened applications, that means that after you've submitted your primary, you've waited a month to be verified, and it goes out to your schools, they're going to take a look at the application, and they're already going to make cuts. Some schools will take a look at your GPA, your MCAT, your personal statement, all of that stuff is going to factor into whether or not they're going to invite you for a secondary. A lot of the UCs are screened, so most of the UC applications, you won't get a secondary unless you've made that first cut. And usually what they include in these secondary applications are additional questions. They might have more questions about your grades. They might have more demographic questions, what kind of disadvantaged background you might have had if you've had one. They might ask you for a photo of yourself, and they're going to use that for your interview day, just to verify your identity. The secondary is really an opportunity to share why you're interested in a particular school. And usually, again, it's because the kinds of questions that they ask you are specific to their mission statement. It's specific to who they're looking for. They want to know if you're a good fit, okay? So again, that research that you're doing at the beginning of the application process is critical, because you're trying to find out which schools are a good fit for you in advance of this application process, okay? The other thing that schools usually include in the application for your secondary is instructions on how many letters of recommendation you should submit. So again, I had my letter writers upload all my letters into Interfolio. Interfolio then sent all of my letters to AMCAST. And then after I submitted to AMCAST, I had to indicate in the AMCAST application, once I heard back from schools with their secondaries, I had to indicate which letters of rec I was going to submit to each school. Okay? And actually, I take that back. I think I submitted, or I uploaded my letters of recommendation even before I got the secondaries. I got the information. So check this out. They might have a lot of the information you need under the MSAR, where it lists how many letters of rec you need. So for some schools, I think I already uploaded it in advance. And for other schools, I waited until my secondary application where they included specific instructions of which letters of rec to send. For UCLA Prime, one of the schools that I applied to, they requested exactly 3 letters. One of them was from someone who saw me in a leadership position. One of them was from a science professor. They had specific instructions, so sometimes you do need to wait for the secondary. Otherwise, you can probably find that information in advance and submit your letters of rec without the secondary. So here's the thing. So secondary applications, a lot of people don't know that it can be a little bit overwhelming. If you're applying to 20 schools like I did or more, if you're interested in applying to more schools, all of a sudden, once all of those automatics, once your application is verified and all those automatics start hitting your inbox, you have, say 20 schools that you need to, prepare applications for. And each of those schools might have, 3 pages of questions. They might have 12 pages of questions. So it can be a little bit overwhelming. And I want to just tell you now, don't get overwhelmed, but get organized and rank your schools in order of priority. So have an idea, which schools are you most interested in? I definitely prioritized the schools that I was most interested in. And then I also prioritized which schools have the earliest deadlines. A lot of times people say that you should be submitting your secondary applications within 2 weeks of receiving your secondary, okay? It can be a little bit challenging to do that unless you start typing everything up in advance. So here's what I did in order to get organized and not feel overwhelmed. I created an Excel spreadsheet where I listed the medical schools that I had applied to. I got the information for the total number of letters of recommendation I needed to submit. And then I included the cost of the secondaries. Whenever I did submit letters of rec, I actually included how many I submitted just to check off that I had completed that task. I kept track of the cost of each secondary application. Some of them were $90, some of them were $140. On average, it's $100 per secondary. Usually, if you qualify for fee assistance, they'll waive your secondary application. Say that you don't qualify for fee assistance, but you still feel that you may be low income, or maybe you're undocumented. For a number of different reasons, you may not be eligible for FAP, even though you should be. You can still contact schools and ask them if they can waive the secondary application fee because of your because it's challenging for you with your income status. So I did not do that, but if you can get your secondary application fees waived, you're going to save a lot of money. Anyway, I kept track of mine here. I also kept track of the date that I received each secondary, and then I kept track of the date where it was 2 weeks from my secondary and then 3 weeks from my secondary. I would recommend you can also have a column here for like the deadline for the application. For me, I tried to submit all of my secondaries between 2 to 3 weeks after I received it. So that's why I gave myself personal deadlines of getting it done 2 weeks out or 3 weeks out. The next thing is that since there's multiple schools that you're applying to, every school has their own website. You'll have a different username and a different password for this application. So unlike the primary application, which is centralized, your secondary applications are not, and you do need to keep track of all of your usernames and passwords. And then I also just kept track of like the dates that I submitted each of my applications. So this is how I got organized, and I ranked my schools again in order of which ones I was most interested in, and then I ranked them based on how quickly I needed to get them out. Okay? Some sample secondary questions. If I could go back and do this process all over again, one of the things I would do is save myself some time by looking on the Student Doctor Network. I don't usually look on Student Doctor Network. I think it would drive me crazy. But people post secondary applications on Student Doctor Network. And some of those secondary applications from last year, like the questions are just recycled every year. So one thing I would do differently is start actually preparing my secondary applications even before they hit. Like even before I've received it, I would try to get it done. So say you submit your primary application in June, you're not verified until July 1st. Between June 1st and July 1st, you can use that time to look up secondary applications and start pre-writing for those secondaries. If not, you're literally going to have, like in my case, I got 18 secondaries out of the 20 schools that I applied to, and literally all 18 of them hit within the first week of my application being verified. All of a sudden you have, 18 additional personal statements to write, more essays. It can be a lot. So I would definitely do it differently by starting to pre-write before my application is verified. Here are a couple sample, here are a couple sample secondary questions. What are the greatest challenges facing underserved communities? That's a question that I got from a school that was particularly interested in working with underserved communities. So you can see that it's a question, like the questions that they ask really do reflect the mission statement of the school. Another question that you might get, pretty common, if you've taken a gap year or gap years, what did you do in that time? Another question that's common, why our school? So what is it about that school that you're going to contribute to? Why are you a good fit for that school? Those are some of the types of questions you're going to get. And some of these questions can range from being tiny paragraphs, like your answer should only be this small, or it can be, a full essay as long as your personal statement, if not longer. So other advice, just start working on your primary app early. I already said that. Start working on your secondaries early, but also don't submit your application unless you feel comfortable with everything that you've put together. Okay, so that was a lot on secondaries. I'm going to take another break for questions. Please go ahead and ask questions right now about this, and then I'm going to wrap it up with some information on interviews and update letters. I got a question, did I take an MCAT prep course? If so, with which company? I did not take an MCAT prep course. I studied by myself. I've actually given an MCAT webinar in the past. If you email me, I can send you the recording for that. But for the MCAT, I actually studied for about a year, and I was doing 20 to 30 hours a week in order to prep for the MCAT. But as long as I think as long as you're disciplined, you can do it. You can do it on your own. Okay, so I see another question. I have questions about the deadlines for each medical school deadline for transcripts when I choose schools in AMCAST. I saw each school has a deadline for transcripts. I have submitted my transcripts to AAMC. Do I have to mail my transcripts to each medical school that I add in my AMCAST? No. So for your transcripts, once your transcripts are sent to AMCAST, when you submit your primary application, that's going to go to all of the schools. Or after it's been verified, it's going to go to all of the schools. When you've actually been interviewed or when you've been accepted, schools will ask for your transcript again, and it's to verify, basically they want to make sure that, if you've continued taking classes, you've what do you call it, like your grades are you're still doing well. So usually you have to submit your official transcripts to schools after this process. So I had to submit transcripts for some schools even when I interviewed, and for other schools only after I'd been accepted and I was deciding whether or not to attend. So another question, I have not received secondaries yet. My advisor said that there are some schools sending out secondaries right away after you hit the submit button. Is it because my application has not been verified yet? Exactly. So your application isn't verified. If your application isn't verified, if you just submitted, it's going to take a while for secondaries to hit. Some schools might send it automatically, but I've only heard of that happening once. Otherwise, honestly, I didn't get any of my secondaries until my application was verified, which was a full month after I had submitted. What do the deadlines for secondaries look like? It depends on the school. Some schools might be really early, some schools might be late. I think one of the school, I submitted everything as much as I could between 2 to 3 weeks after I had received the secondary prompts. But for some schools, like the deadlines are pretty late. It can be, I don't know, October, November. Do you suggest having someone look over your application before sending it? Yes, especially your personal statement and your 15 activities. Again, pick someone who knows you well, pick someone who is familiar with the process, a physician or a medical student, and then pick someone who has excellent grammar. Did I have a mentor to guide me through this whole process? I had several, I had several mentors, I guess. I have a lot of people who are in medical school who are friends, who I was able to get advice from. Definitely seek out mentors. How will you know which schools have automatic or screened secondaries? You know what? I think the MSAR actually lists that information, whether or not a school is automatic or screened. You can usually tell because the automatics come automatically. Like you'll get your application verified, and then you'll get like 10, secondary applications in your inbox that day. The next day, you'll get another 10. Like it's very clear when it's automatic because, if you've just been verified. And also, AMCAST will actually alert you when you've been verified. Like once your application has been verified, you can see that it has been. So at that point, all of a sudden, you're going to just get a bunch of automatics. And most of them are private schools. Okay, any other questions before I move on to interviews? Okay, so these are the last slides. All right. So for interviews, you've submitted your application, your primary, you've submitted your secondary applications. At that point, they have your full application, it's complete, and they can decide whether or not to invite you for interviews. There are a couple different types of interviews that you might see. One of them is a traditional interview. So you might go in and talk to one person, maybe two people, and you have an hour just to talk. So during those traditional interviews, they're just going to want to get to know you a little bit better. And, they might ask you questions like, tell me about yourself, and, why medicine? The multiple mini interview is a new type, a relatively new type of interview format, which has been adopted mostly by schools on the West Coast. And the multiple mini interview can be, anywhere from like 8 to 12 interview stations. And each interview, so you'll have multiple interviewers, and each interview is only like 10 minutes long, 15 minutes long. And they're going to be asking you different questions. So, this can be structured in so many different ways. At UC Davis, there are actors who might be interacting with you, and they'll give you, a section where, or a session where you might have to, demonstrate your interpersonal skills working with a colleague, okay? So they might give you a scenario where you're working with a colleague and you need to resolve that scenario. And somebody is basically just judging your interpersonal skills. Another multiple mini interview question might be the standard types of questions like why medicine? Tell me about yourself. What are your strengths? Other multiple mini interview questions can be ethical questions. What do you do in this situation? There's a lot of different types of questions you might get in the multiple mini interview, but the nice thing is that you have multiple people who are rating you. It's not just based on one person's assessment or two people's assessment of you and your interview. Sometimes you might have a combination of the two. So if you have a combination interview, you might have, one traditional interview, and you might have, 3 or 4 mini interviews. It really depends on the school, what they want to do. One thing to note is that there's a difference between closed versus open interviews. They often tell you whether or not an interview is closed or open. In a closed interview, it means that they have never seen your application. That means that they don't know anything about you. They've never seen anything, with you. Like they don't know you. So you're starting on a blank slate. In an open interview, the person has already read your file. They know who you are. They've read your personal statement. They might have direct questions to ask based on what they've seen from your application. So in preparing for interviews, make sure you review your entire application, both your primary and your secondary application for that school. Do your homework, look into the school's mission, and again, think, reflect, why are you a good fit for that school? Third piece of advice, definitely practice doing mock interviews. And lastly, take some time to journal and to reflect on why it is that you want to study or practice medicine. The more that you sit and reflect on that, the more it'll be easy for you to talk about it when you're actually in the interview setting. These are just some common interview questions. The first is, why medicine? Tell me about yourself. What is a challenge you've experienced and how did you overcome it? Why are you interested in our school or program? And also, what are your strengths and what are your weaknesses? For that last question, usually if they ask you what are your weaknesses, you'll want to talk about your weaknesses, but also talk a little bit about how you're working to overcome those weaknesses. How are you improving upon them? Okay. Definitely wear corporate attire, not business casual. So make sure you're wearing a suit, even for women. I did not know that during my first interview, so I made the mistake of dressing more business casual, and I was in a sea of suits. So make sure you're wearing a nice suit for your interview. And then the last things that I want to talk about are update letters and letters of intent. So after you've gone through this process, say that you've submitted your application, your secondary, and you haven't heard from the school, you can submit an update letter directly to the admissions email or through your student portal. Double check what's accessible to you, and you can give schools any kind of substantial updates to your application. So for example, if you've taken additional coursework, you can talk about new grades. If you have new awards, new honors, if you've published, or you have additional accomplishments that you want to talk about, you can send that in your update letter. You can also submit any large changes from what was reported in your application, especially if they're addressing weaknesses in your application. Like say you don't have as much clinical or as much research exposure, but you've done more of that since you've submitted your application. You can talk about that in your update letter. I submitted an update letter to UCLA because I hadn't heard from them. I hadn't gotten an interview from them yet. And soon after I submitted my update letter, I got an interview at UCLA. You have to remember that there are people reading these applications. So when you submit an update letter, it indicates that you're still interested in that school. You can also submit an update letter after you've interviewed. And also, this is a special kind of update letter, a letter of intent. If a particular school is your top choice, say for example, I don't know, your top choice is Oregon, whatever it is, it's UC Irvine. Whatever your top school is, if you've interviewed, you can send them an update letter that indicates that you will enroll in their school if you're given the opportunity to attend. So you're basically saying that this school is my top choice, okay? And you're giving them more updates. Why are you a good fit for that school? Say that, you've been accepted to, 2 different programs, but you still haven't heard anything from the school that's your top choice. You can send them a letter and you can say, I've already been accepted to this program and this program, but your school is my top choice. If you accept me, I will enroll. And here's why I'm a great fit for your school. I actually included again here some resources. There's an example of the letter of intent and also a website for you to look up the letter of intent. And then the last thing that I want to talk about is if you're really set on a particular school, like you're really, really gung-ho about being at a specific school, you can think about doing the early decision program. What that basically means is you're only going to apply to one medical school by August 1st. I know that seems scary, but it means you're really committed to this school. And what happens is you're basically committing to that school if they're offering you a position through the early decision program. So if the guidelines are met, then you're going to be notified of the school's admission decision by October 1st. If they say no, you still have time to submit applications to other schools that you're interested in. Okay, so that's it for my presentation. If you have any questions, we have about 10 minutes left. This webinar is being recorded, so I will be sending it to everybody who is registered and also uploading it to YouTube. Yeah, anyway, if you have questions, please do it now. So there was a suggestion here. So Together We Mentor is part of MiMentor.org. If you have not yet been able to connect with a mentor, I recommend that you create your account in MiMentor.org. I'm going to type it here so that you can see it. And that's a way for you to start getting connected with medical students and doctors. How did I practice my interview skills? How do I better prepare for it, especially if you're shy? How did you do well in group interviews? It's just a matter, again, of connecting with mentors and asking if you can practice. The more you practice, the more comfortable you feel, especially if you're doing, all of these common questions like the tell me about yourself, the why medicine. Yeah, I mean, that's really all it is just practice. And how did I do in group interviews? I actually only had one group interview, and it wasn't really a group interview. It was just me and one other person. I think the most important thing is just making sure that you give the other person time to talk and you're not being selfish and taking over all of that time. Okay, so I got somebody who requested information about the MCAT. I don't have access to your email addresses through here right now, so if you can, just shoot me an email at midi@phdreamers.org, and then I'll go ahead and send you the MCAT webinar that I posted a couple weeks ago. Okay, any other questions? I know it was a lot. I'm just going to hang out here until 7:30, so if you guys have any other questions, I'll go ahead and hang out here. What is my biggest challenge in the whole process? I think secondary applications were particularly challenging. There are a lot of different challenges to each step, but I think for me it was just making sure that I felt comfortable with all of the secondary applications that I submitted. You have a very short period of time to answer a lot of questions, and so that was challenging. I think the other thing was waiting. It takes a long time, so just learning to be patient and being comfortable with waiting a little bit before you hear back from schools. When does medical school start? So I'm in UCLA Guffin, and the classes won't start until August 8th. but I'm in the middle of the pre-matriculation program right now. So yeah, it's exciting. Okay, it doesn't seem like there's any additional, oh, there are a couple more questions. Okay, so to clarify, for the early decision program, you can only apply to one medical school. Can you not apply to other medical schools meanwhile, or is only applying to one medical for early decision, but you can apply to the rest, not early decision? You're taking a risk. You're only applying to one medical school. And it's only until October 1st that they can give you their decision. If they accept you, great. It's your top choice. You just got accepted to your top choice. If they didn't accept you, then you're late in the application cycle. You're basically submitting to all of these other schools on October 1st or after October 1st. So at that time that you're doing early decision, there's only one school designated in your AMCAST application, and it's not until after October 1st that you're able to do additional schools. What are the resources available for med students at UCLA? So this is really specific, like resources available at UCLA David Geffen School of Medicine. I'm still learning about it. I know it seems like there's a lot of faculty support with all of the deans who are here. They do have a learning specialist here, and what do you call it? Just yeah, like today, actually this whole week is called Prologue to Medicine, and it's a pre-matriculation program for non-traditional students or non-science majors. I was non-traditional psychology. So they gave us a full week they're giving us a full week of resources like study skills workshops, networking with the deans and with other medical students. So it's a full week to just help me in getting ready for medical school. Another question. Will I be doing research in medical school? Yeah, I definitely will. I've been doing research for a long time, and medical school is excellent because once you've been accepted into programs, they provide you with just so many rich opportunities to get involved, and I want to take advantage of that. So the next question, can you still apply to the same school after being rejected through the early acceptance program? You can apply to them the next year. You can't apply again within the same application cycle, but you can apply the following year. So if you really want to get into that school, you can try again the following year, but you would be taking a risk if you did early decision again. Okay. 2 more minutes, so if you guys have any additional questions, please feel free to ask. I got a question, where did I go to undergrad? Was I a traditional or a non-traditional student? I went to UCLA for undergrad. I was a non-traditional student. One of the things that I share very openly is that I was undocumented until last year, which made it difficult for me to apply. Most schools would not admit undocumented immigrants until a couple years ago. So I'm very non-traditional. I graduated literally 10 years ago. And in the meantime, I've just been doing the best I can to get exposure to medicine and to research. I also do a lot of work for the undocumented student community through Pre-Health Dreamers. So again, if you're interested in learning more about pre-health dreamers, please look for our website, phdreamers.org. Follow us on Facebook, and feel free to reach out to me if you're undocumented and you have issues specific to applying into medical school as an undocumented student. Okay, it's 7:30. I have to get going, but thank you for inviting me out to do this, Min, and MiMentor. So I hope that this was useful for you guys. And if you have any questions, again, feel free to reach out. Take care. Bye.